Welcome everyone. Today we're going to discuss about something about quality. Quality can be measured and improve in multiple level. Number one, community. Population-based denominators, multiple way to define denominators. Example, country HRR application to all provider. Practice setting, denominator based on practice setting. Individual physician, denominator bound by patient's care for applied to all physicians greater component of a physics total performance. So quality we need to be measured. Quality we need to be very much focused on quality. Rational address measure proliferation. Proliferation of measures uses by HHS agencies for neuros program and initiative. Redundance and overlap leading to provide or data collector burden, conflict result, inefficient use of HSS resources, and lost opportunity to drive improve through reinforcing program use of key measures. No formal systematic mechanism to align, coordinate, and approve development, maintenance, implementations, and retirement of measure across HHS program. Recent work done by Million Hertz, Partnership of Patients, Internal CMS Quality Measures Task Force, and MU2. HSS Measures Policy Council, assembled in spring 2012, which membership represent across HSS agencies, establish and operationalize policies for HSS-wide measures development and implementation. Work to date has focused on reviewing publicity available HHS measures inventory and tackling topics around 9 measures area, developing a coordination plan for future measure development, piloting rule for categorizing measure across the federal government and multi-stakeholder group. MPS guiding principle. Focus on measures and policies that maximize quality improvement, minimize provide burden, and allow for assessment of the health of population. Deliberate aging with national quality and prevention strategy. Leverage lesson learned from relative HSS and external activities. Developing consensus on standard definitions for data components of measures as well as measures themselves. Maintains a portfolio of easier access artifact from MPS deliberations. Recognize alignment may not always be appropriate, but document justification when this occur. MPS scope of work. To date, the Measure Policy Council has received and prioritized measures in 9 major areas: hypertension, depression, smoking, uh, hospital acquired care coordinator, patient experience, HIV or AIDS, parentals, and obesity. So these are some of the care, some of the things we can take alignment in healthcare industry. So this is the thing I think all of you as a professional you know. But what is our job? Our job we have to create a real quality control procedures. So when we maintain the high quality control procedures, we can achieve more success. We can gain more success in the healthcare industry. Uh, so this is one of the strategic logic. Ground level activities, what will support the initiative, then you have to focus on initiative, what action could contribute to the desired result, performance measure and target, how will we know if we are achieving desired result, objective and desired outcome, what continuous improvement are needed to get result, goals, what are our main focus area for improvement, what result are needed to satisfy stakeholders, vision, what is our picture of the future, mission, what do we exist to do. The strategy is to currently pursue three aims: better care, improve overall quality by making healthcare more patients centered, reliable access, and safe. Health policy, health communities, improve population health by supporting proven intervention to address behavioral, social, and environmental determinations of health in adding to the delivery high quality care. Affordable care, reduce the cost of quality health care for individual, family, employers, and government. Care coordinations, patients and family activities, infrastructure and process for care coordination, impact of care coordination. Populations, health, behavior, access, physical and social environment, health status, efficiency and cost reductions, cost efficiency and appropriate safety, all cause harm, HAC, HACS, HAIS, unnecessary care, medical safety, person and caregiver center experience, patient experience, caregiver experience, performance and the goal orientation. So, what is the objective? Improve support for a culture of safety, reduce inappropriate and unnecessary care, prevent and minimize harm in all settings. Promote effective preventions and treatments. Objective: increase appropriate use of screening and prevent service. Strengthen interventions to prevent health attack and stroke. Improve quality of care of patients with the multiple chronic conditions. Improve behavior, health access, and quality care. Improve uh, parental outcome. So these are the some basic information. Always I try to share because when you have like a right kind of attitude, when you have right caring attitudes, this is very important. You can successful. So customer management system vision of quality measure, align measure with national quality strategy and six major domain, implement measures that will critically gaps within the six domain, particularly patient experience and patient reported outcome. Align measure across CMS program whenever possible. Promote parsimonious and core set of measures. Remove measures that are no longer appropriate. Align measure with external stakeholder including private payers, board and special society. Improve measures over time. So these are the many important aspects of our important of our healthcare system. So I know all of you are from healthcare system. So it will help you to understand, and if you it will develop your preparation. So I want to start from our students. So what you learned today, can you share with me, Mr. Peace? Can you share with me what you learned today?
Hello, I come late. I don't know the title of this topic, so I come late.
Okay.
Mm.
Uriyangi?
What we learned today, we saw some of the things we take care in healthcare industries like hypertension, obesity, and other things. Those are the things we saw that they can be taken care in healthcare industries. The other things we studied is about MPC, measurement and in policy council.
Okay, okay,
I
thank you.
think
Thank you.
so. That you're
Thank
welcome.
you. Christine, I cannot hear you. Okay, thank you, thank you. Devotee,
Thank you. What I learned today, it's to make a care safer, some objective where we can improve to support our cultural safety and reduce inappropriate unnecessary care where we can give necessary care and avoid unnecessary care and where we can prevent and minimize harm in these all settings. Thank you.
thank you, thank you. Kantuangin, am I right? Yes. Can you share what you learned? Okay. Mbiani, Robert, can you share what we learned today?
So I have a question.
Yes, 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 yes.
Thank you very much, lecturer. I wanted to ask first of all, what what could be the definition of quality?
Okay, very good, very good. Okay, thank you, thank you. Okay, quality means, like example, we are discussing about healthcare industry, right? So when we discuss about quality for when we discuss about healthcare industry, so healthcare industry quality means customer management system. So when customer means who is the customer? Patient. When as a healthcare worker we can take care all of the patient properly, that is the very important aspect. That is the way we can improve. That is the way we can take care. That is the way we can care about our patients. So when we care properly based on customer management system, this is called quality. Let's say we provide better treatment, we provide better service, we provide better medicine, we provide better environment. That is called good quality. That is called good quality.
Thank you very much.
Welcome, welcome. Thank you for your questions. So CMS vision for quality measures. Align measures with the national quality strategy and six major domains. Implement measures that will critically gap within the six domain, particularly patient experience and patient reported outcomes. Align measure across CMS program whenever possible. Promote parsimonious and core set of measures. Remove measures that are no longer appropriate. Align measures with external stakeholder, including private players, boards, and especially society. Improve measure over time. Landscape of quality measure. Historically, a silo approach to quality measures. Different measure within each quality program. Different report criteria for each quality program. No clear measure development strategy. Typically, disease-specific measures. Confusion and burdensome to stakeholder. Burdensome to CMS with established solutions to quality measures. The future of quality measures for improve and accountability. Transition measures quality measures away from setting specific narrow snapshot. Uh, so so capture measurement in three main level. Number one, individual clinicians, group, and populations. These are the area we can focus and we can bring necessary outcome. So there was a question from you, like how we can ensure the quality. Let's say pharmacy care, laboratory, hospital, pharmacy, specialist, in all of the aspect, if we can care properly, that is called quality healthcare system. So this is one of the example how a patient can a doctor can take care or a nurse can take care of the people of their people. uh, so this is some of the measures that we can focus, that we can understand sex, we can understand genders, we can understand the particular registry, clinical database, research database. Many of the things we can identify and we can take necessary initiative. Measures alignment. EHR as a primary reporting platform with secondary reporting from registry claims. Only those who provide care can improve care. So care with no dashboard. So definitely we have to care about, right, we have to give them right information to the right people via the right channel, via the right format, at the right time. This is very very important for our development. So this is some of the focus area we can measures. If we can measure personal health record, electronic health record, health information exchange, NAT and international health analysis. These are the many structures we can follow and we can take care of human resources. Okay. So definitely in the advanced country, there is a strategy like quality measurement strategy, and if you can follow this kind of strategy, ultimately you can achieve some sort of success. Okay. Next, my next questions to you. what is your questions about IELTS? Reading, writing, listening, spoken. Uh, I want to give chance everyone, like what you learn, what you want to share about IELTS. Mr. Peace, what you want to share about IELTS? Do you finish anything?
Uh, we thank you. The ITS is a international exam.
Yes.
We have some fear in that exam. Uh, I have like a suggestion. I think those who prepare or ask ITS exams, they have some key. They have some questions uh, they use and the method they use to ask. So it would be better if you you prepare for us how the question is supposed to answer, so that maybe we get in January with some standards, or we will be able to win that exam. Mm. Until now, ITS is an exam based on four standards, like writing, listening, reading. Those are the key points they use to ask. Where the ask is like common info, information you have, and they see how you respond. They see how confident you are. And it is taking. We have to be like confident in what we learn and what we know. So you have to prepare for us some questions, maybe online interview like this, how we take courses online, so that maybe one day you ask one person, another day you ask one person, so that maybe we reach on January 15th, already know what to respond, our weakness, or what we have to improve, so that we can achieve the ITS goals of 7 or band 7. Thank you.
Thank you. Thank you. Who want to share more about IELTS? Because I need to know that you understand.
Hello, sir.
Yes.
First of all, thank you, sir, for this session. I want first to thank you for this session, and I wanted to
Thank you.
ask to to say something like when we are in the when we are taking this session of learning. Uh, I was suggesting that maybe we try to read and we try to speak some so that the others can so that we improve in our language of speaking, and so that when times goes on, so that you can understand it, that the students are trying to maybe to speak and understand what the lecturer is trying to speak. Thank you.
Thank you. Thank you. Uh, who want to share? Devotee, Uriwangi?
Uh, what I can say about ALTs is a system or a strategy of an exam which will have four statements like listening, reading, writing, and spoken. And also it will have to someone who will, will do it. We have to know about good vocabularies, how to organize the words, Uh, also, also, she or he will know how to use time correctly, to respect time, to respect grammar, good vocabularies also, as I said. The other, and also well understanding what will be asked. I think that's all. Yeah.
Very good.
Thank you.
Who want to share more? Kantuangi or Christine? Yes. Okay, okay, thank you. Thank you. Kantuangi, you want to share?
Excuse me, I'm not listening very well. Who tried asking for?
Okay, okay. So, like example, I want to give you task. Okay, let's say I want to give you task. Example, one of the important tasks come, which is about vocabulary. So, let's say Mr. Peace and Uriangi, you two, you select two article from BBC, you read it and find out five words, new words you learned today, and you have to share with us. Mr. Peace
Yes.
and Uriwangi.
Mm. The new vocabulary.
Mr. Peace, can you read an article?
Yes, I'm searching the article.
Okay,
I'm
okay.
searching
And
the article.
Uriwangi, you
Yes.
can search an article. Everyone can search an article.
Yes.
Mhm.
So can I read?
Yes.
There's an article uh, uh, said North uh, Shropshire by election has Boris Johnson lost his winning touch. It is a question of a topic question written by Alexi, political correspondent, BBC News, 3 hours ago. How did the Conservative lose one of their fastest seat to the Liberal Democrats in one of the biggest upsets in recent election history? Questions over Christmas parties in Downing Street undoubtedly uh, ignited the North uh, Sh- Shropshire by-election campaign, but before that opposition parties has already picked up a sense of people in its safe, rural, tourist feeling valued and overlooked. Both, both the Liberal Democrats and the Labour pushed the idea of conservative votes being totally granted, pointing to leveling up money going to formerly rock-solid Labor-led war area in the Middle East and northern England rather than North Shropshire. The risk for Conservatives is that the same sense generated in this by-election is replicated in other Tory heartlands. Uh, when Mr. Johnson won a landslide in 90 2019 general election, he ripped up the old electoral map and charged into Labour area. The challenge he has now is how to keep all those voters on side, finding an approach that speaks to newly won Tories in the Midland and North without alienating traditional voters elsewhere. It is a big topic, but new vocabulary here that is what they call um, like
Okay, no
we
problem.
don't know those England parties like North what you call the no liberal Democrats, conservatives. Those are kind of the parties that are located in England and how they are PM of England is kind of losing some electoral seats for those who are in the liberal democratic. That's what I can speak in this topic. This yeah.
Okay. Thank. Okay, I just want to share some of the informations again for IELTS because I believe that still there are some gap. What is IELTS? IELTS is an international English language testing system. Are there other English language testing system? Yes, there are. Depending on your interest, tests like TOEFL, TOEIC, BEC, FCE, and many other exist for choice. Why IELTS? IELTS is recognized by every English-speaking countries as a test of English proficiency, and although other tests are similar, they may have a particular focus. For example, TOEFL is focused on North America. What else? IELTS has the option to taking the learner in a specific directions. It has an academic focus and it has a general focus. So everybody has to attend in the academic examinations. So I want to become a doctor. What should I take? Academic. Okay, as you are nurse, you should take academic. I want to live and work in English speaking country. Which line is study is best? Then it's general. So where I can take the IELTS test, there is an IELTS test center is over 125 countries with the test average 50 per year is over 500 locations. Is the IELTS test easy and what is the pass score? There is no pass score with IELTS. Remember, IELTS is a test of English proficiency. So depending on the pass score recorded by the immigration or employer or university, you must work to that score. What are the score band and can you give some example? The score band is the chart of next slide. Take time to review them. From major English speaking countries, 6.5 is the score required for immigration purpose. However, entry to a university may require a higher score. For example, Oxford University required a score of 7. So this is the sum of the information about IELTS. So I request everyone, please take preparation every day, at least finish one reading, one writing, one listening, and one spoken test. Thank you everyone for joining today's session. Thank you. Bye bye and take care.